May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknitya Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. I welcome all of you in lecture 4 of antihypertensive agent. So in this video, that is in lecture 4, we will cover angiotensin second receptor blocker. Learning outcome: after completion of this topic, student able to know about the chemistry and SAR of angiotensin receptor blocker, understand mechanism of action and uses of angiotensin receptor blocker, draw the structure with Ipac and uses of angiotensin receptor blocker. So as we seen in previous lecture about angiotensin second, which is formed from the angiotensin 1 by the enzyme ACE, and this angiotensin second is a octapeptide and it have various physiological action. So here again there is a various type of effect of angiotensin second. So here the main effect is vasoconstriction, then aldosterone secretion, ADH release. So angiotensin second causes vasoconstriction, therefore increase the blood pressure. Similarly, it stimulate ADH release, which causes reabsorption of water, concentrate the urine and increase the blood pressure. Similarly, aldose secretion, it increase the reabsorption of sodium, therefore the concentration of sodium increases, which leads to the increase in blood pressure. So overall, angiotensin second increase the blood pressure, but all this effect is produced when angiotensin second bind with their receptor. So after formation of angiotensin second from angiotensin 1, this angiotensin second bind to their receptor and produce these effect. So there are 4 receptor of angiotensin second, namely AT1, capital AT1, comma AT2 and AT3 and AT4. These receptor belong to GPCR, G protein coupled receptor, but here the important one is AT1 receptor. It managing a specific cardiovascular activity. So stimulation of AT1 receptor by angiotensin second result in vasoconstriction, aldosterone synthesis and ADH secretion. So the receptor of angiotensin second are 4 types: AT1, AT2, AT3 and AT4. All are GPCR receptor. So here the important one is AT1s. After combining with AT1 receptor, angiotensin produce this effect. So administration of competitive antagonist that inhibit angiotensin second will produce vasodilation effect because of substrate for this receptor. So angiotensin second is an octapeptide. Much of earlier work was performed by using various peptide system or peptide system. One such agent is SAR-lysine or called as SARA-lysine. So here as name indicates SARA-lysine, here SAR means sarcosine, ALA means alanine, SIN means angiotensin. So it is a combination of 3 SARA-lysine. So this SARA-lysine, it is also octapeptide, but it is different from angiotensin second by 2 amino acid. That is, instead of aspartic acid, here there is a phenylalanine. Similarly, in case of angiotensin, on one position aspartic acid is there and on 8th position phenylalanine is there in case of angiotensin second. But in case of SARA-lysine, on first position sarcosine, it is also amino acid, and on 8th position there is a alanine. So it is the difference between angiotensin second and SARA-lysine. SARA-lysine also octapeptide, angiotensin second is also octapeptide, means it contains 8 amino acid. But the structural difference is, in case of angiotensin second, first amino is aspartic acid or 8th amino acid is phenylalanine, But in case of saralacine, first position there is a sarcosine, and on 8th position there is a alanine. The use of these agent was limited because it has partial agonist activity. However, it serves lead in development of other agents that are useful in antagonizing effect of angiotensin II on their receptor. So saralacine also act on angiotensin II receptor, but it is having limited use. Significant development of this class come from the series of imidazoline 5 acetic acid derivative. These compounds are exemplified by S8308, where later found to be specifically block angiotensin II receptor. Although this compound weak antagonist, the computerized molecular modeling by using computerized molecular modeling, there is a overlapping of angiotensin II with structure of this S8308. Shows that there are three structural binding site on S8308 and is overlapped with the three binding site of angiotensin II. So after saralacine, there is a development of imidazoline 5 acetic acid derivative. So it is a development of 5 imidazoline 5 acetic acid derivative. So the first compound, that is S8308, as this name is given because this product is not come into the market due to various problems. So the first compounds developed as an angiotensin II receptor blocker is S8308. So this compound is overlap with the angiotensin II by the using computerized technique. So this compound is utilized for study purpose, and by computerized technique this compound is overlapped with angiotensin II, which is an octapeptide, and it is found that there is a three binding site of S8308 which is overlapped with three binding site of angiotensin II. So which is this three binding site? The first binding site is this one. First binding site, in that ionized carboxylate group of S8308 correlate with carboxylate group of phenylalanine of angiotensin II. So it is the first binding site. The carboxylate group of this drug correlate with the carboxylic group of phenylalanine, which is the 8th amino acid in case of angiotensin II. Second, that is this one binding site, imidazole ring of S8308 correlate with imidazole ring of histidine of angiotensin II. So this imidazole ring is correlated with the imidazoline ring of histidine of angiotensin II. Third binding site is this one, that is N-butyl group of this drug correlate with hydrocarbon side chain of isoleucine, which is 5th of angiotensin II. So these are the three binding site of these drug which overlap with the binding site of angiotensin II molecule. So this three binding site, again I repeat, first binding site is this one, that is carboxylate group of this drug correlate with the carboxylate group of phenylalanine, which is the 8th amino acid in case of angiotensin II. Second binding site, imidazoline ring, it is correlated with the imidazole ring of histidine, which is the 6th amino acid in case of angiotensin II. Third one is N-butyl group correlated with the hydrocarbon of isoleucine, which is the 5th amino acid in case of angiotensin II. So it is a just comparison of binding site of this drug with angiotensin II. From this 8308, number of molecule modification were carried out to improve receptor binding and lipid solubility. The first successful agent to be developed is losartan with receptor affinity and oral activity. So it is a first drug S8308. So first drug developed which is come in market is losartan. So if we see the structure, it is a look like same. Geometry of this structure is approximately same. So losartan is the first drug of this category come under the in the market. Similarly, it is a imidazole derivative. So losartan, it is a imidazole derivative. Another example of this category is that is valsartan. Here is there is a no imidazole ring. So it is the first non-imidazole antagonist, and it is highly potent than losartan. So this valsartan is not contain imidazole ring. So it is a non-imidazole derivative, and it is more potent than the losartan. Amide carbonyl group, this one, amide carbonyl group of losartan of valsartan is isosteric with imidazole nitrogen of losartan. So this part of valsartan is isosteric with the imidazole ring of losartan. Now SAR of this drug. So in case of SAR of angiotensin second receptor blocker, it is a common structure. It contains imidazole ring, phenyl ring, and there is a acidic group. This acidic group are three types. First one is simple carboxyl group, that is called as A. Then there is a biphenyl, B is a tetrazole attached to phenyl ring, and third that is C phenyl ring with carboxylic group. So this acidic group are three types, A, B and C. This is a common structure. Above structure is common, but the difference is acidic group. So acidic group may be carboxylic group, may be tetrazole phenyl ring, or it may be phenyl with carboxylic group. The first point in SAR, the acidic group is thought to mimic either tyrosine phenol or aspartate carboxylate group of angiotensin second. So this acidic group may be carboxylic group, may be phenyl tetrazole, and may be phenyl carboxylate. Second point, in biphenyl series. In biphenyl series means when the acidic group is B or C. The tetrazole must be in ortho position for optimum activity. So if acidic group is B or C, then it is important point here that this tetrazole and this carboxylate group should be ortho. If this group is shifted to meta and para position, then activities decreases. So second point, in biphenyl series, the tetrazole must be in ortho position for optimum activity. Third point, the N-butyl group provide hydrophobic binding and mimic side chain of isoleucine. So as we previously discussed, correlation between angiotensin second and S8308. So here same point is given. N-butyl group, that is N-butyl group, provide hydrophobic binding site and mimic the side chain of isoleucine fifth of angiotensin second. Fourth point, imidazole ring is isosteric equivalent and required to mimic the histidine of angiotensin second. Fifth point, substitution with variety of R group. This one is R group, including carboxylic group, methyl alcohol, ether or alkyl chain is required to mimic phenylalanine, which is the 8th amino acid of angiotensin second. So it is the some SAR point of angiotensin second receptor blocker. Now individual drugs. So in that first drug is losartan. So first is Ipac name. So here 2-butyl means it is 2. There is a butyl group, 2-butyl, 4-chloro. So it is a 4-chloro. 1 means this 1. 2 means this 2. So on second position there is a 1, 2, 3, 4 tetrazole. So it is a 1, 2, 3, 4 tetrazole. 5-eel. So here there is attachment, that is 5-eel. Biphenyl means there are 2 phenyl ring, biphenyl. 4-eel means here is 4-eel. Methyl means this methyl. Imidazole, it is a imidazole ring. 5-eel, on fifth position there is a attachment, and methanol, so it is a methanol. So it is a fifth position attachment. So I have picked name 2-butyl 4-chloro 1, 2, 1, 2, 3, 4 tetrazole, 5-eel, biphenyl, 4-eel, methyl, imidazole, 5-eel, methanol. Uses, losartan is used for the hypertension. including in people with left ventricular hypertrophy, that is enlarged heart muscle, and kidney dysfunction among the type 2 diabetic. Losartan is recommended as first-line treatment in people under the age of 55 who cannot tolerate ACE inhibitor. And second drug, that is valsartan. So here again there is a Ipac name 3-methyl. So here is numbering is given. There are 4 carbon with carboxylic group, that is butanoic acid. So on third position there is a methyl group 3-methyl. Then on second position N, that is N 2. So here means again this one is 2, same ring is attached, that is 1 2 3 4 tetrazole. 5-eel, again there is the same 5-eel. Biphenyl same, 4-eel again same. Methyl, this one is methyl pentaamido. So here there is a 5 carbon with amide group, that is pentaamido, and this one is butanoic acid. So 3-methyl 2 in bracket N in bracket 2 dash 1 2 3 4 tetrazole 5-eel biphenyl 4-eel methyl pentaamido butanoic acid. Uses valsartan is used to treat high blood pressure, heart failure, and to reduce death for people with left ventricular dysfunction after having had a heart attack. In people with type 2 diabetes and high blood pressure or albumin in the urine, valsartan is used to slow the worsening and development of end-stage kidney disease. So apart from hypertension, these drugs are used to protect the kidney, especially in case of diabetic patient. Last drug, telmisartan. So it is a structure of telmisartan. So here again Ipac, it is a benzoic acid. This one is benzoic acid. So according to benzoic acid on second position, so it is a 2, then 4. This one is 4. 4-methyl, so it is a 4-methyl. Then 6 on 6th position there is a ring, that is 1-methyl 1,3-benzodiazole. So it is a 1-methyl 1,3-benzodiazole. Second position there is attachment 2-eel. Then propyl, so it is a 2-propyl. This one is propyl group 2-propyl. 1,3-benzodiazole, so it is a 1,3-benzodiazole 1-eel. Methyl, so it is a methyl. Phenyl benzoic acid, so it is a phenyl benzoic acid. So it is Ipac name 2,4,4-methyl 6,1-methyl 1,3-benzodiazole 2-eel 2-propyl 1,3-benzodiazole 1-eel methyl phenyl benzoic acid. Telmisartan is used to treat high blood pressure, heart failure, and diabetic kidney disease. So it is about the angiotensin II receptor blocker. If you like the video, then subscribe the channel. Thank you very much.